Moving on to other stories. Now, it's a global issue which has no respect for age, gender, or race. But suicide has a lasting impact on those left behind. And here in Nigeria, attempted suicide remains a crime. But as research suggests, greater numbers of young people are taking their own lives. Mental health advocates are calling on the government to decriminalize the act and improve care. So, I've been speaking with survivors and experts to find out how best to support those struggling with their lives. In 2003, the World Values Survey said Nigerians were the happiest people in the world. But in a rare twist of events, the happiest people now rank one of the top countries most affected by suicide. Those at the center of this are Nigeria's future, the youths. For years, 27-year-old Sheifumi Yusuf felt like his life was spiraling out of control. Though surrounded by friends and family, he remained isolated and lonely. He began to self-harm and overdosed on prescription medicine, escaping death by a whisker. Looking back, he tells me he's grateful for his second chance at life.
Now I am grateful. Back then I wasn't. When your illness is present, gratitude has no place, or gratitude becomes oblivious, or you're unaware that you have to, appreciate life or the little things, the fact that you are even able to realize your thought and presence in that moment. So, so then I didn't appreciate it, but now I do, because I get to see that now people are now having to go through struggles that things that I've struggled with.
According to the World Health Organization, the majority of people who die by suicide suffer from a mental health issue, some of whom had not been diagnosed. In 2015, 27-year-old Awa Ojeifo found herself struggling with suicidal thoughts. She sought medical help and fought hard to overcome her negative feelings. She now uses her experience to help others.
I had to deal with being in a career path that I think I was struggling, and perhaps on the inside I didn't feel like was my true calling. I had to deal with my social circle and whether I really liked the kinds of people that were surrounding me. So during that period, it was a complete overhaul. I left my job, I sort of switched my friends and social circles. I left home for 9 months because I was like, you know what, and from here onwards, I'm only going to do what I want to do.
But statistics from the World Health Organization suggest that more help is needed. It says that in 2016, suicide was the leading cause of death among 15 to 29-year-olds all over the world. In the past 2 months alone, there have been more than 8 reported cases of suicide across Nigeria. And in spite of being illegal and stigmatized, it seems Nigeria's millennials are at growing risk. But why and what's behind this change? I'm meeting a behavioral coach to find out.
Traditional media and digital media, they need to take responsibility, because they are fanning what we call the weather's effect in psychology. And the weather's effect simply means that once it is out there that this person committed suicide this way, around that time the spike in suicide rate shoots up, because people become what they behold. So when media continues to put it out there and people are watching, and they can relate with the circumstances that led that person to it, and they escape, right? People will try to follow the same route. And so we need to be a lot more careful.
Like the behavioral coach, medical experts agree that explaining the rise in suicide is not as simple as identifying one medical cause. As such, they argue that help needs to be widely accessible and not limited to treatments offered by the medical profession.
National Suicide Prevention Helpline should actually do us a whole lot of good. Why? We have the telecommunication companies. They can work with that. Let it be toll-free. Let people now volunteer to come on board. I'll give you a very recent case in the UK where the royal family just started up Shout, and Shout have a linkage with crisis text line from US. So they did not start something, they did not reinvent something. They did not go, so let us reinvent the wheel. They said, look, crisis text line in US is working. Let's work with them. Let them come and tell us what to do.
Like countries everywhere, Nigeria's future rests with its young. For those who came close to ending their lives, but who opted to live instead, the future is something to be cherished, as they are the people who will shape it. They urge anyone who is struggling to seek help and find hope.
When we think of suicide, we're always looking at the person, but it affects your family, it affects your friends. You know, it affects us collectively as a society, you know, because there's that secondary trauma that people have to deal with.
Indeed, a story of resilience and hope. If you are going through a hard time and need to talk to someone, there is help available. You can reach out to NGOs such as the Mentally Aware Nigeria Initiative. They can be reached on 08091116264. That's 08091116264. And there's further support offered through the She Rights Woman Mental Health Initiative. It has free helplines on 08174913329 and 09070063161. Also 09070063160. They are only a call away and are always ready to talk to you. For more information, and if you need those numbers, again, check out our Twitter page at Gist Nigeria TV. And earlier, I had a sit-down interview with Dr. Maimuna Kadiri, a psychotherapist, and she shared a few tips on what and what not to do when you are with someone dealing with suicidal thoughts. Take a listen.
The do's are very key. One very important do in our list is for you to listen non-judgmentally. If you are in the same environment with that person, take away anything that that person may use as a weapon to harm himself. The third one is, please link that individual up with a professional. Suicide is a public health issue, it's a serious issue, and it shouldn't be trivialized and be seen or normalized.
Thank you, Doctor, for those tips. So how are other countries dealing with suicide among young people? Let's take this week's 360 roundup. In Scotland, suicide has never been a crime, and there is a Mental Health Act which allows compulsory treatment for people with mental illness. A mental health tribunal comprising a lawyer, a psychiatrist, and someone with relevant skills decides whether a compulsory treatment is to be given to a person. In 2012, Ethiopia's Ministry of Health introduced a national mental health strategy. The strategy mandates that mental health be integrated into the primary health care system. This made mental health services available at local hospitals, and primary care staff are trained in the skills necessary to identify and treat people with mental illness. Still ahead here on Gist Nigeria. Hitting the streets of Accra, we meet Ghana's skateboarders right after this.